Hey guys, I know it has been a while since I made a video and some things have happened since then, so I'm going to fill you guys in. As you can see by the title of this video, I am leaving the healthcare field to go on a new venture. I know, can't believe I'm saying that. I am excited, nervous, anxious. I can't believe I'm doing it, but I'm more excited than anything. It's kind of like the first day of school where like, oh, you got to meet new people and all this stuff. So I feel crazy that I'm actually saying that I'm leaving healthcare, but I wrote down some reasons. I wrote down a couple of things about my new job that I'll fill you guys in on. And then I'll also let you guys know, why I didn't fulfill my 2-week notice because of an incident at work. And I want to say that everything that I describe in this is based off my experience working in healthcare. I know that this is generalized to a lot of different professions and most jobs, but it's coming from my point of view working in healthcare because that's all I've done. So please don't take offense. Don't come for me. So a little bit of background about me. I have been doing healthcare, like CNA/nursing, for going on 10 years. I worked as a CNA while going to nursing school, got my LPN in 2016, and I've been working as an LPN ever since. I became a nurse because when I was younger, I started taking care of my grandma, and I loved it. And that kind of prompted me to be like, you know what, let me just start out in the healthcare field and get my CNA, and then if I like it, I can get my LPN, RN, so on and so forth. So I stopped at LPN because student loans are outrageous, and honestly, LPN school drained me, and I'm happy being an LPN. I can work in OBGYN, family medicine, home health, nursing home, skilled nursing, all that good stuff. So I felt like it was versatile enough where I could eventually find my niche. Clearly that hasn't happened, but it was just a good stopping point for me because I was making money to be comfortable enough to afford my bills, pay things off, make a living, and still have fun, whatever. So one of the reasons that I'm excited to take this leap of faith is because nursing can be emotionally and mentally draining. The job itself, especially the ones that I've done, is not physically demanding. You are running around, walking around, going to all these different places in the facility to get things done, but for me, that's not exhausting. I like being busy. It keeps my anxiety level down because I'm not thinking of other stuff that doesn't mean anything, and I'm taking care of people. So it's just come to a point where I am mentally and emotionally burnt out. I would spend 30 minutes to 45 minutes on the phone scheduling these appointments for patients and scheduling MRIs and CAT scans and all of these different appointments for patients. And when I would call them, they just wouldn't care. And it would upset me because all of this time that I took to do this for you, to try to help you out, I could have been scheduling a scan for another patient that would actually appreciate it. And it happened all the time on a daily basis. And I'm like, why am I doing this? Also, management really tends to suck in these places. Again, this is based off of where I've worked, not for everybody. As hard as you work, as hard as you want things to change, it really never does. If they don't take it above and go to higher ups, CEOs, assistant managers, and managers going to whoever's in corporate, it's never going to change. And feeling unvalued and unappreciated in a place where you basically care to get more people taken care of than taking care of yourself, that just really brings your morale down. Like, it makes me feel like poop. My overall health has gone downhill. It's been downhill since losing my dad, but when I first started where I previously left, I was excited because it was a new role for me. I was a clinical lead supervisor. I would order supplies, order vaccines, fill in for medical assistants when they need to go to lunch. I would train medical assistants on, how to do EKGs, how to administer testosterone injections, all of that good stuff. Do the nursing schedule. And then they stripped those away from me, but that's a whole nother story. So my overall health, I would just be eating my feelings, because when I would ask for support, like, hey, can I get the password to order this? Can I order this because we need it for this procedure? They would be like, oh yeah, let me look into that. And they would never get back to me. And it was just stressful because it was so unorganized where I was previously. And I would just be eating my feelings. DoorDash, Uber Eats. People that I worked with would mention food from somewhere, and I'd be like, yes, that sounds delicious. Let's order. So I also noticed, I would want to do these things when I get home, like start laundry, cook a nice dinner, vacuum, water the garden, whatever. I would just go to sleep. 6 o'clock, 6:30, I was in bed, and I would stay there until the next morning when I got up at 6:45 and do the same thing every single day. And it just got old. You're doing the job of 2 and 4 people, and wearing all of those hats and not being valued by your employer gets old. And it makes you, when people you work with don't care, you kind of get to a point at some point where it's like, why am I doing all of this? You could easily be doing this with me. You could be helping me, and you're not, and I'm doing all of it. You just get burnt out. You're over it. And I asked for a pay raise at my past job because I was doing the scheduling, doing the ordering, doing everything, training. And they said, we don't want to put the stress on the company right now. We'll discuss this at a later time. That really infuriated me. And I was told after 90 days of being hired that I would receive a pay raise. Mind you, I've been there going on 6 months. So it's well past my 90 days. And it just, this last place, which is where a lot of this is stemming from, even though the management thing is pretty much for a lot of practices I've worked for, it just, after the pay raise thing and basically just being another employee to these people really made me realize, what am I doing here if you don't actually value me? Because I value myself. I love having my nursing license and I want to help people. But if you're just using me, why am I here? And when they took away all of that, my primary duty at this place was to do the Medicare wellness exams. For those of you who aren't familiar with that, those are exams that you give to Medicare patients. And it's like a Medicare questionnaire, if they smoke, if they drink alcohol. And I do a clock test with them. I give them 3 words to remember to make sure they're not developing dementia and make sure they can take care of themselves. If they can't, I'll put in home health referrals, physical therapy referrals, anything that they need. Mammogram orders, bone densities, colonoscopy orders, those types of things. So that's primarily what my job role has been for like the last 2.5, 3 months at my previous job. I didn't mind it. I love geriatrics. Old people are adorable. Most of the patients I had doing these exams were amazing. And quite shockingly, I had 80 and 90-year-olds that could probably run circles around me. Don't know their secret, but they looked really good for their age. So that wasn't the issue. The issue was I started out doing 6 to 8 of those exams per day, which was a good amount because I'm very thorough. I write notes. I tell their provider, hey, they failed their clock test, blah, blah, blah. But then I guess they would get reimbursed or something before June 30th, which was supposed to be my last day. And my number went from 6 to 8 a day to 11 to 15, sometimes 16 or 18, because they would just throw them on my schedule. I have to prep these charts to make sure that their last mammogram, colonoscopy, DEXA, all of that is in there. And I pull records from places if they were recently hospitalized, all that good stuff. So when they were just throwing them on my schedule, or if they were there seeing a provider for a 3-month follow-up, not on my schedule, and they would message me and be like, hey, go see this patient, they need their Medicare wellness, I'd be like, seriously? Like, I haven't even prepped this. I have 3 patients coming in like 20 minutes. So it was just a fiasco. But I would try to get it done. I would do my thing. And basically, that's all they wanted me there for. Once my schedule went from 6 to 8, they didn't ask me, how are you handling it? Are you feeling okay? Are you feeling overwhelmed? Are you able to get the exam done in the time allotted that we're giving you? Things like that. They were just throwing them on my schedule to get them done, get the money, send them on their way. And I am not with that. Life is too short. And when I got this job opportunity where I'm going, and money isn't everything to me, but living here in America, money does make this world go round, and I have bills to pay. I have to pay my bills. And when they threw the number out at me and I was like, this is just starting out, like I have no experience, and they're like, yeah, we're going to do this for you. We're going to give you 8 to 10 weeks paid training, blah, blah, blah. I was like, yeah, like what? So life is too short. I'm taking the leap of faith. I am going into insurance. I'm going to be working in like auto, property, home insurance company. I will be an auto claims examiner. I do need to get my adjuster's license. So if anybody watching this works in insurance, or you know someone that works in insurance and you can give me pointers about working as an auto claims examiner, please feel free to leave that information down below or private message me. Do what you got to do. Because this is all new to me. I've only done healthcare. But I'm super excited. I really like learning new things, and this will be one more thing on my resume, whether it works out or not. I can always go back to healthcare. I do plan on keeping my LPN license active. I'm going to do my continuing education units and all of that. As a nurse, I loved doing what I did when I felt valued, whether it was by the patient, by management, by coworkers. But you spend so much time taking care of everybody else that you put yourself on the back burner. And mostly everyone I talk to that does not work in healthcare is so happy, so much less stress than what I have had to deal with working in the healthcare field. My mom works for insurance. My brother's girlfriend works for insurance. My ex worked for insurance. He wasn't stressed at all. And this isn't just for insurance. I'm sure there's a lot more less stressful jobs out there. But when I got the opportunity, I was like, you know what? I'm just going to take it, because I've been thinking, like, do I want to just do like a part-time nursing job and work part-time somewhere else to just take a break from healthcare? And then when they called, I was like, you know what? Everything happens for a reason. They're offering it to me now. I'm doing it. So here we go. And I told you guys, I think, I'll tell you what happened with my 2-week notice not being fulfilled. So this past Monday, which was like the 20th, my original last day was supposed to be June 30th. But Monday, an incident occurred where a patient came in, 20, 30 minutes before her appointment, and she needed her Medicare wellness. So in the little chat thing that we use to communicate with all providers and all staff, because we're all everywhere all the time, we're never really stagnant in one place, usually, the manager was like, hey, this patient's here. She's going to need her Medicare wellness, blah, blah, blah. Coincidentally, her provider's nurse came into up front where I was sitting, because I had brought papers up front to be scanned in the scan pile. And I was like, hey, did you read the chat? And she was like, yeah. And I was like, so what do you want to do? Do you want me to do my portion and then she can see her provider after? Or do you want the provider to see her and then I do it? We were trying to get it figured out. Well, here comes the manager. She had a stack of papers that she printed, which is like basically the Medicare questionnaire. And she was like, hey, this patient's coming in. You need to give her these questions. You don't need to tell her what they are. Just give them to her. And I said, no, I am not going to give a patient forms, have them fill it out without discussing it, telling them what they're due for, telling them what it is and why they're doing it. She proceeded to get aggressive verbally and tell me, you need to do it. She's due for it. And I said, yeah, I will do the exam once I explain to her that she's due for it. And then she don't even have to fill that out. I'll just ask her verbally. She was like, so you're refusing to do it. Do you want to go home? And her tone, I was like, you know what? I do. I clocked out right then and there, grabbed all my stuff out of my office, and I left. Couple more things were said in between that time. When I was collecting my stuff, she was telling the practice, I don't know what he is, manager or whatever. She was telling him, because he had hired her, that I was refusing to do this exam. And when I came out of my little office, I said, I am not refusing to do the exam. I told you I refuse to give her a stack of papers you printed and not explain to her what it is, why she's doing it, and why it's needed. I am not just going to throw that at my patient. And that's what you wanted me to do. And she proceeded to get nasty with me. And I was like, I may just be a nurse, but I still have morals. And I grabbed my bag and I walked out. Came home, thought about it. I was like, I don't want to be at a place that does not value me, and they are just using me. And the way she talked to me was so uncalled for. Like, she was just on one from the start that Monday morning. Like, in the chat, she was getting short with people. She was being snappy with front desk. And it's like, what? Why are you talking like this, And usually when I go in the morning, I'm doing my own thing. I clock in, I get my stuff ready for the exams. I start calling my patients back when they come in, and I'm rolling. I'm doing my thing. She started talking to me that way, and I was just like, screw this. Like, I'm not going to be talked to like this. You don't even know me. B, you don't really know what family practice is about because you came from a whole different specialty. C, if you talk to me like this and you want me to just give a patient papers without explaining, that's just not what I'm about, honey. So I didn't show up. That next day, Tuesday, I didn't show up. I had one of my front desk girls text me and they were like, they really thought you were going to show up today. And I was like, I'm not. If she wants to apologize to me for the way she talked to me and the way she handled the situation, I'm all for it. But I'm not going to continue working in a toxic environment that is unorganized, total chaos, and I'm not appreciated. I'm not doing it. You were using me to get reimbursed for exams. And my last day, y'all would be doing this same thing, just throwing all these exams at me without being prepped. The patients are just a number, and I couldn't do it anymore. So that's that story, and I'm sticking to it. But like I said, I'm excited to try the insurance field. I will still be helping people, but in a completely different way. And I can always go back to nursing if I want, but I don't know how insurance is going to work out. I'm going to keep my nursing license active, but who knows? You never know where you're going to end up. Doors open all the time, and this is a whole new adventure for me. So, like I said earlier, if you know anyone who works as an auto claims examiner, y'all have pointers for me, please let me know, because I am kind of freaking out. Like, this is all new. It's going to be like going to school again. But I'm excited. I wanted to fill you guys in. Kind of sad that I won't be, taking vitals and helping patients and educating them. But again, this is a whole new adventure for me. So I'm just going to buckle in and take the ride. Please leave your questions and comments down below. I'm hoping to hopefully get a new computer within the next month or so. I'm trying to save for one. And yeah, I'll see you guys in my next video. I apologize that the editing is so terrible because I can't edit on this phone. I try and then I end up messing it completely up. So I will see you guys in my next video.